Welcome back to Botox Cowboys. I'm here today with Andrew, and we have a special guest today, Andrew. Who is it?
We got my man, Dr. Jesse Thompson from out in Roslyn, BC. Jesse is a very well-rounded physician who I have had the pleasure of getting to know over the last 6 years. And Dr. Thompson, thank you for finding time to join us today. Can you introduce yourself to our listeners?
Yeah, what's up, guys? Happy to be here. I am a doc working in a small ski town in the interior of BC. My practice is split up into 3 branches. I do pain and regenerative medicine, integrative and functional medicine, and aesthetics. So got a lot of other arrows in the quiver personally, but that's my medical life.
How did you have the misfortune of meeting Andrew?
Oh, yeah. God, he hit me with his car.
Standard.
No, I
That's
did
how he meets most of his lives.
Yeah. I did his training course in Vancouver and went from there.
Now, Jesse, before we get started here, where can our listeners find you? What's your social media handle and your website information?
Yeah, so my clinic's called Prime Medical. That's where you can find everything for us online. Our website's very comprehensive and inclusive, and as is our Instagram. So we're available for everybody there.
Is it at Prime Medical or what's the actual handle?
I think it's Prime Medical Roslyn.
I take it you don't run it yourself.
Yeah. You see how acquainted I am with it, eh?
Yeah, 100%.
Well, that could be the first A on Botox Cowboys.
Yeah. Now, talk to me first just about, we met through the Botox course and the filler course. And, Botox Cowboys is a podcast themed around aesthetic medicine. Tell me a little bit about your aesthetics journey, how you came into it, and what it's been like for you so far.
Sure. Yeah, I started injecting Botox for medical reasons before aesthetic reasons. And I do a lot of stroke, migraine, dystonia, blepharospasm in my medical practice. And I was getting pressured to inject aesthetically. So I went on a hunt for the best course in North America and settled on Botox course. And that's what led me to you guys. And it's kind of taken off from there. I would say aesthetics is about 15 to 20% of my practice right now. So it's definitely not the majority, but quite a bit of energy devoted to that in my day-to-day.
Amazing. As this aesthetics journey has evolved, what have you liked about it? What have you not liked about it? And how is it factored into the many different things that you've got on the go?
Yeah, it's been really fun because this is the part of my business that I run entirely with my wife. So we work together with every patient. She does all of the behind the scenes work for those patients in our practice and is with me when I see all of them. So it's been good to work together in that capacity. We've kind of went through several clinic locations and built up practices in different towns that we're still maintaining. So it's been fun, and it's really nice to see healthy people and just have positive conversations all the time. And it's a really good vibe in the clinic. In terms of what I don't like about it is I think the first thing that comes to my mind is seeing some of the results that I see from other injectors when patients come in to us brand new, and just seeing that people sometimes get taken advantage of and they don't get what they're asking for, but it presents us with an opportunity to correct that, right? So there's a silver lining.
If it's Jesse, if it's 15 to 20% of your business kind of thing, is it a really competitive market there where you are, or is it just not all that popular? And if it's the second, are you doing anything to kind of encourage those treatments in your area there?
Yeah, I'd say there's definitely other injectors around. It's not like we're the only game in town by any means, but I like to think that we're the best. And so we don't do a whole lot to recruit and attract patients. We don't do a lot of advertising. We just kind of let our work speak for itself, and word of mouth spreads naturally. And I would say that we're as busy as we want to be for that side of things. you'll see on our social media, I'm very particular about saying that I don't push this on people, and that when we have new patients come to us, we actually prompt them to take a very small initial step just to make sure that they're psychologically comfortable with what they're getting themselves into, and then they feel, good before and after about their decision. So we really slow play it. Just out of morality, I think.
Yeah, I think, Tyler, that was a good question. So this is more of a highly nuanced point within aesthetic medicine that I think we've just brought up here that we haven't touched on previously. Clearly, there's medicine, there's medical aesthetics. These things are comprehensive in nature. But one advantage, Jesse is a very talented injector. I've seen him over the years. I've done many sessions with him. He trains with us now as a lead educator at the Botox course. So his work speaks for itself. But I do think that there's such a key point that he doesn't have to upsell people. He has all of the different things that he does. He mentioned integrative medicine, emergency medicine, pain management, all of these different things. He doesn't have to work so hard to convince people to get treatments. And as you mentioned, Jesse, people come in oftentimes with problems because they've been oversold. And this is something Tyler knows about me and my practice, and anyone that works with me is I'm there to listen, see how I can optimize their aesthetic needs and do it without upselling them into things that they don't need. So,
man, you've been trying to get me to do a lip flip since I met you.
Oh, don't do it.
Do you do that? Thank you. I got another.
Yeah, don't do it.
Yes, thank you, Jesse.
No,
don't do it.
No. So this is actually really funny. I've got you two guys on the call, and this is why I wanted to do Botox Cowboys, because both of you are very much guys. You're outdoorsmen.
Prefer not to drool. Yeah, that's right.
Yeah. So, well, here's the thing, though. It's a good procedure. Jesse actually got one of my lip flips, and we really enjoyed it.
I was going to say something different about it. Maybe one of the biggest regrets of my life. No, it was bad. It was real bad. You shouldn't do it.
What did you feel? Obviously I haven't done it and I won't. So thank you. That's the confirmation I needed.
So it wasn't as much about what I felt. It's about that every time my wife looked at me, she would burst out laughing for about 2 months. So
it was very effective.
Yeah, I think I'm the wrong person for the treatment. I didn't need any more volume. I didn't need any more lip paralysis. So, it changed my perspective though.
It's good you did it once. If you're injecting it, you should.
Exactly. Tyler, you're up, buddy. So I almost got Tyler there because he's down in Texas now, so I couldn't do his treatment. So he said, Andrew, send me the right treatment so someone doesn't mess up my face. And he didn't realize that I included the lip flip on it.
I get down there, and actually I was in Texas, but I was actually all the way down south in Colombia. And so I had to explain to this lady, because he didn't actually make points on draw a face. He just kind of wrote it out. So I had to explain to this lady in a second language for me what he was talking about. And then I had to also explain that I didn't actually want a lip flip. And he had done the math all the way down on how many units. So then she thought that I needed X number of units at the bottom. I'm like, no, but minus the units for the lip flip. So making sure I get the right amount in all the areas. It was a big mess. So thank you. I really appreciate it. It did make me laugh though, actually. It made her laugh too.
Did she just allocate the lip flip units to your Scrotox?
Well, that's what I was worried about.
Yeah, I didn't really specify which part the lower it was intended for.
Yeah.
Now, well, that's great. We're going to get Tyler to do a lip flip at some point here. But one thing I wanted to talk about a little bit is integrative medicine. And, I've actually gone to see Jesse to learn more about, what he does and comprehensive wellness, regenerative medicine, bioidentical hormones. There's a lot of buzzwords around this right now, but maybe Jesse, could you talk to us a little bit about what comprehensive functional medicine and all of that means?
Yeah, absolutely. So the idea behind integrative medicine is, and integrative medicine and functional medicine are often used interchangeably. But this is about looking at the person as a whole from a foundational health perspective, in the light of longevity, in my mind, anyways. Everybody defines this kind of different, right? But our clinic, we're looking at 360-degree approach to healthcare for the long term. And so every patient we see, we bring them in based on short, medium, and long-term goals, where they're currently at. And a lot of people come to us 95% optimized, and they just want that last little bit of performance or health edge. And a lot of people come to us with a lot of work to do and a lot of easy, work that they could maybe do on their own, but they need the support and motivation and accountability to do so. Such as, simple lifestyle base pillar optimization. But one thing that I will say about this space as well is it's very similar to aesthetics. People practice this with very different patterns, and people market the heck out of it and will sell patients grand schemes and packages, lots of testing, but there's not a lot of long-term planning and involved. And I feel like that's a disservice, where we try to really plan to follow along with people and get involved in their life and commit them to a positive change.
A large component of what you're doing is effectively preventative medicine and optimization. And that is very different than what you find in this Canadian healthcare system, which is very much often reactive and doing nothing proactively. So when you're thinking about optimizing someone, can you break that down a little bit for us?
Yeah. So I guess one great example of, reflecting on what you just said is metabolic health. So the traditional medical system will measure your 3-month average blood sugar once you turn a certain age. So that's usually in your 40s or 50s that you get your first measurement. And this is a very blunt look at how your body's handling carbohydrates and sugars. Generally, nothing is done or suggested about this until you hit a, pre-diabetes arbitrary number cutoff, or maybe even a diabetes cutoff. However, there's multiple other biomarkers that can be measured to help us understand how your body is handling those same macronutrients like sugars much, much earlier in the process. So we're using not only, fasting sugars as a spot check, but going back and looking at how your body's using insulin. So we do a fasting insulin number, and this is the first marker as to what your metabolism is doing. So when your 3-month average is still well below the pre-diabetes cutoff, and maybe even your fasting sugar is within an acceptable range, we'll pick up people who are starting to have insulin resistance, who are starting to have metabolic problems, and we'll start to treat that before it becomes an issue in terms of the conventional medical system. And generally what we're using for treatment is, exercise, diet alterations, sleep optimization, sometimes some peptides and medications and supplements, of course, but certainly not waiting until people are in a designated disease category.
RFK likes this.
Yeah, you know what? It's not like that. That's where people popularly see this idea, but this is happening everywhere, right? This is becoming much more popular because it makes sense. And I think that we'll see this become mainstream in, a number of decades. But the financial motivation of the powers that be, it's a really difficult shift from sick care to healthcare. And, I can't begin to say that I have the solution for that problem, because that it almost requires a multiple generation plan. But we've been trying to do our part here.
Well, there's no study in the world, I don't think, that shows anything but positivity for exercise. So yeah, keep that going.
No, and I like that, sick care to healthcare. That's great. Okay, 2 just spot questions for you, Jesse. Quick hitters. Peptides. This is the buzz. I get asked about this literally every single day now. Give me your Cole's notes.
Sure. Peptides are not new. Peptides are very trendy, and peptides do many different things. Okay. So I think the key is identifying what you're trying to do and then looking at the peptide that may do this for you, and then looking at the other options you have for doing the same thing, right? So a good example is BPC 157. You have X injury. BPC 157 is great for some injuries in some contexts, as long as you can get a formulation of BPC 157 that A, has what it says it has in it and isn't contaminated with polysaccharide. And then you're being directed on how to use this appropriately for your specific injury. But I have lots of people that come and ask about lots of different peptides that are fully planning on using them for something that's just not going to work, right? So it's very interesting because these have been around for a very long time. They're getting the marketing machine behind them. And I think people, I don't want to discount this whole category because lots of them are very useful, but they're not the fountain of youth, and they're not the be all and end all of medicine.
Do you think that if used inappropriately or for the wrong reasons, they just simply don't work, or can they actually be harmful?
Yeah, I mean, I think the most common thing I see is, I have lots of patients that come to me, they say, oh, I did this. And the most common thing is it did nothing. I wasted my money, right? But usually these are by injection, and people are doing these at home. So anytime you put a needle in your body, there's a risk, right? You can get an infection. You can hit something that you don't want to hit, albeit that's unlikely. However, there's also a growing concern, especially in Canada with these research-only labs producing peptides, that they can be contaminated with something called lipopolysaccharide, which is a inflammatory compound that needs to be filtered out when peptides are made. And it's seeming like a lot of these companies are not filtering that out properly. And so people who are using peptides from a certain spot that has lipopolysaccharide for long periods of time are coming in with inflammatory reactions.
And that's for injectables. And there are tons and tons, my feet's full of them, oral options. Are they just a complete waste of money in your mind?
It depends what it is, right? If you have ulcerative colitis and you're going to take BPC 157, you want to take that orally because you want to get it on your guts. However, just like any other medication, when you take it orally, it has to go through your detoxification system, so your liver, before it gets to your bloodstream. So the injectable versions bypass that. So they take the liver and they take your metabolic system out of the equation. So often they're a little bit more potent anyways, not necessarily to say more effective. It really depends on the compound that you're talking about to answer that question.
I just got a text here from Brooksy saying, ask him if there's a peptide for gray hair.
Man, I'm just happy to have hair. There's nothing wrong with this color. You know how much people pay for this color?
We'll hook up offline. Yeah.
Okay, Jesse, what are your thoughts on metformin as an anti-aging therapy?
Yeah, so this was very popular, maybe a decade ago. Lots and lots coming out since then about how metformin can, quote unquote, block the effects of exercise, though. So the very slight lactic acidosis that we get from metformin use can diminish the positive effects of exercise in some way. So I don't use it in my practice carte blanche for longevity. However, it is a useful tool for insulin resistance and creating more insulin sensitivity if that's the patient's problem. And by other routes, we haven't been able to approach that and handle it. However, I would say, going back to peptides, that I would probably rather use a tirzepatide, Ozempic, Mounjaro rather than a metformin for insulin sensitivity promotion at this point, in light of that lactic acidosis. So, and I think that's not, anything new to somebody in this realm. We've been kind of seeing this with lots of self-experimentation people have been doing over the last 5 or so years with GLPs, even at micro quote unquote micro doses, lower doses, just to promote insulin sensitivity rather than weight loss.
Amazing. I get really excited talking about preventative medicine, comprehensive wellness. What would you say is one of the biggest problems with the Canadian healthcare system as it currently stands, and how it relates to the health and wellness of the Canadian population?
Yeah, I guess just to put it very shortly, it seems like 95% of our dollars go to the 2% of sickest people. And there's not a lot of resource left over for this preventative health education and support. Education and support is really what's required for the first 90% of your health. You need to understand what good sleep looks like and how to attain it. You need to understand what a relatively good exercise program, nutrition program would look like for your life. And people just don't know these things. And if we could get this in everybody's hands, we would see a lot less hypertension, hyperlipidemia, things that need to be managed in primary care. And right now there's so much of it that a lot of it goes mismanaged. It grows into bigger problems. And these are why our hospitals are full, right? This is a broad strokes overview, but it seems like all of our resources are available as soon as you are on death's door, right? No holds barred in terms of your care at that point. But to give you a personal trainer through our medical system is unheard of, right? So it seems a little bit backwards, but like I said before, I don't have the solution of how to get out of that problem.
Well, you kind of said it. You guys both have kind of said it. So you guys put together the point here that Canadian healthcare is abysmal. And you've also put together that there's absolutely no preventative maintenance there or anything like that you can do. So what can you do? Exercise, like you said, do everything that you can to take, preventative maintenance into your own hands. Get out. You don't need necessarily a trainer to just go walk more, or I don't know, attempt to see a gym or do push-ups. Like I'm sure, people starting out with five push-ups off their knees a day and progressing into whatever they can would have some type of positive effect that maybe prevent something down the line. So if your healthcare system denies you anything meaningful from that perspective, then you should get doing stuff.
Yeah. How's it going for you? Are you at 10 yet? We started on 5 last week.
From my knees, I can do 10. Yeah.
Okay. Good man. Hey, you know what? Progress is progress.
That's right. Yeah. I've never felt better. A little sore. My boobies are sore.
You've hit on a couple really important points there. I could talk about this forever. So just so you know, I think I have a very good solution to how to fix the big problem in Canadian healthcare. Now, I'll just, we've got great doctors, we've got great nurses. This system is unfortunately set up to fail and hemorrhage money and be inefficient and cause significant morbidity. It's bad. So, and then the second point is you talked about, how early education could help someone's development. And all I could think about is like, man, just think if we educated Tyler the right way, where he'd be in his life right now.
I turned out okay.
He'd already have had 12 lip flips, right?
100%. Now, Jesse, what's it like being a guy in a female-dominated field?
I mean, I don't feel it that much here, right? We're kind of in our own world in our clinic. We have other injectors in the region, but it's great. I mean, all of the negatives that I could think of being a male injector, I've mitigated because all of my work I do with my wife. So there's always both of us in the room. So that's been amazing. And my practice wouldn't be what it is without her. And I wouldn't even do it. Right. So she's the relatable one, the personable one, the one that everybody, is able to text and talk to and review their results with. So I think she probably brings most of the value to the practice, not me. But I don't know. I haven't really felt any of that asymmetry in the gender of the stream of aesthetics, just because we kind of stay in our own little world.
That's such a great answer and a segue into, my next question. And you're right. I guess, out in Roslyn, a bit of a smaller community, but, you know, we always try and give pro tips to injectors and patients out there. And I would say that, there are a number of male physicians that I know that practice out of the basement of their home. They don't have an assistant. And I would just say that is a big, big risk you're taking. And I would be very, very cautious. And Jesse, you have an amazing wife who I've had the pleasure of meeting. You guys are working, you're very synergistic and contribute, very, very much to the business together. You have a beautiful family. Talk to us briefly just about what it's like for you balancing being fit, staying active, running, your different medical practices and raising some beautiful kids.
Yeah. Happy to talk about that. So I have 3 kids. They're 2, 4, and 6. I also have 4 or 5 businesses on the go, aside from medicine. And what I would say is that, you can be as busy as you want to be. And I had to make a very, very conscious cut in allotable work hours about 4 years ago. And then another cut about 3 years ago, 2.5 years ago, where, I've really seconded down my work time to time that I, otherwise can't be with my kids. They're at school, they're at preschool. And so now I work 4 days a week. And when I'm at the office, I don't stop. I don't take breaks. It's very, very, very efficient and everything's optimized around getting as much done as possible. But when the day is done, I've made time to, coach my kids' sports and be at their piano and make sure that we get lots of family time and every weekend off. So it's certainly not easy, but it's possible as long as you're very strict about your calendar. But I've had you gotta make tough choices. You gotta cut out the work meeting that's a flight away that takes you away from your family for 2 nights, and you gotta cut out other commitments that you don't absolutely have to do. And I've done a lot of delegating, and again, like my wife runs a lot of the administrative pieces of each of the businesses, and so that's her full-time job. And without her, I'd have to hire multiple full-time assistants. So lots of irons in the fire, though.
It's good to hear you're busy, though. I have 2 kind of quick questions for you. One of them, to get back to kind of aesthetics a little bit for a second. Do you do, I guess, fillers and biostimulants also, just so that the people in your area know? And of all of the things, and you can of all of the treatments, and you can actually include in here, exercise and whatever else you'd like. But what, in your opinion, is the best value treatment? Maybe you could do 2, one for your overall appearance and one just for cost wise.
Yeah, I have a pretty full spectrum aesthetics practice. Pretty much everything injectable we use. In terms of best bang for your buck, this is a hard one because you have to start early. But in my opinion, if you've been fit and healthy for your whole life and you've never been overweight, that's the best thing you can do in terms of anti-aging. Most of the 60, 70-year-old males and females that you see that you're like, wow, you look great. If you ask them, have you been active and of normal weight for your entire life, they'll usually say yes. And I ask everyone. So that's kind of maybe a cop out because you can't go back and redo.
No, but you can make those choices now.
I guess in that light, I would say resistance training is probably the best conservative thing you can do for mental and physical health and appearance.
That's a really good answer.
You want me to tell you what's the best injection?
Yeah.
The lip flip.
Yeah. What's his favorite injection?
Yeah.
Yeah, that's like, I'm not going to give you a straight answer on that one either, right? That's depending on the patient, depending on the stage of life. I've tended to go more towards biostimulators over fillers lately, doing some blending when you want a little bit more volume. I like replacing structure conservatively. So templar biostimulator mixed with some filler, like in the temples, when people are starting to get some hollowing there, that's a great way to reverse first signs of aging, and it lasts a really long time. So people love it.
That is a super good answer and advanced. So everybody in Roslyn there is lucky to have you near them. My final question. What is it like working with Andrew on the Botox course? And can you give me some sort of impression on what he looks like up there or sounds like up there or does? Give it like, I don't know, throw some dirt.
Yeah, it's a dream come true. It's just a miracle to be in the presence of genius whenever I get the opportunity.
Such an idiot.
No, I mean you can hear him coming from 3 blocks away with his exhaust. No, it's great, and I'll like just fully, honestly, I admire his dedication and how crazy it's been to grow a thought to what it is now, and to have such a comprehensive, excellent product that prevents people from going down the wrong path with their career and educating them very appropriately for the industry. So, I'm super grateful that I get to be a part of it. And, whenever anybody's asking me about who they should train with, it's always Andrew's organization, without a
It's
doubt.
not exactly throwing dirt, but that's nice.
Well, I appreciate it. Very honored.
We got a couple stories, but we'll save them
for another episode. We got to have him back on it. Okay, so last thing for our listeners, give me 3 fun facts about Jesse Thompson that no one knows. Maybe not no one knows, but give us 3 fun facts that our listeners should know about you.
My sport growing up was archery. I grew up very competitively in that scene, shooting all over the world, and managed to win our Canadian championships a few times and get a silver medal at the World Championships. So I've turned that into a store in a town nearby with the archery range, and we've got 50, 60 kids that are going through our program of learning how to shoot archery and compete and hunt responsibly. So that's a really cool thing that that was a big part of my life for a long time, and still is. I still hunt with a bow. I guess the second thing is I'm an avid hunter. So I'm out there with the rifle and with the archery equipment every year, and managed to shoot a nice elk this year. So that's something that a lot of people don't know about me. I got 3 little boys, 2, 4, and 6. Like I said, they're awesome, and they're already getting into sports, and I'm already trying to plan my calendar around what theirs is going to look like down the road, because I have a feeling they're all going to play hockey, and that's going to be a mess. But yeah, that's a nutshell for you.
Amazing. Between you and me, we could teach Tyler how to aim and shoot a gun.
Yeah.
Oh my God.
Anyways, no, that's awesome.
Well, just go to Walmart, get a water gun first, and practice in the bath, right?
Yeah.
Shooting ducks, shooting rubber ducks.
Yeah, you got it.
Oh, man. Well, listen, Jesse, we really appreciate your time joining us today. Fun fact about Tyler, just before, in the interest of sharing, Spotify brings out their Wrapped, of the year, where they showcase your most listened to artist. Tyler's was Taylor Swift this year. I'm not totally surprised. And yeah, anyways,
use Spotify.
All right. Needless to say,
all right, let me wrap this thing.
No, I got to wrap it real quick, and then you wrap it. I wrap it and you wrap it.
Well, you wrap it then.
Okay, I'm wrapping it. I'm wrapping it. So yeah, Dr. Jesse Thompson, everyone check him out. Prime Medical. And, if you want a great treatment, this is your guy. And if you're looking for comprehensive care, and I can speak for it myself, having learned from him, incredible physician, well-rounded and high integrity guy. So Dr. Jesse Thompson, Prime Medical, really appreciate you joining us.
Yeah, thank you guys.
Yeah, that's awesome. Okay, so then that's it for Botox Cowboys this week. Thanks again to Pete Wright from True Story FM, who still won't let Andrew inject him. Maybe Jesse, maybe you have a better chance of that. And as always, hit subscribe, follow Andrew on Instagram @TheAestheticsCoach, and check us out at BotoxCowboys.com.